Bismillahirrahmanirrahim. I'm Dr. Abdur Rahman and we are learning ECG. In our previous video, we have discussed about different leads of ECG in detail. In this one, we will learn about the cardiac axis. Let me take you back to the whiteboard. And before learning about axis, I want to tell you about two very basic concepts which we learned in our elementary or primary school days. So first one is about the vector. We remember in our mathematics or physics that sometimes we were given some questions that for example vector A is this and vector B is this. So we are used to ask to add both of these vectors. So how will we add it? We used to add like this. We will put vector A like this and we will take vector B and we will put the tail of vector B on the head of vector A, and then after that we will draw a line, another vector from the tail of vector A to the head of vector B, and this vector will be vector A and B. It will be showing the resultant, it will be the resultant of addition of both the vectors. So similarly, if we have let's say if we have another vector, vector C, and we need to add vector C as well. So again what we will do, we will start from the tail of the first vector to the head of the last vector, and then there will be a new vector A plus B plus C. And similarly, in case if we have another vector which is called vector D, and again we will start from the tail of the first vector to the head of the last one. So this one will be A plus B plus C plus D. So this vector. So this is how the vectors are added. Okay, and we all know from our school days. So just keep this principle in mind, because to explain about the cardiac axis, I need you to know about the vectors and how these vectors are added, and ultimately this vector will lead to the formation of our cardiac axis. And this was the concept number one. And then concept number two, we know that what is electricity? Electricity is nothing but the flow of electrons. And usually, and a flow of electrons, how electrons flow in reality, they flow from negative to positive charge. This is what is in reality. But in physics, there is convention to show the flow of current from positive to negative direction. It is not the reality, but it is convention. So this is the same thing, because it is convention, it is being practiced for long time. So that is why here again we will take the flow of current from positive to negative, because it is what is written in all the it is taken as a universal truth, you can say that, and it is the convention. So this is the second concept. Now come back to our medical field. So we have our heart with a thicker left ventricle and a thinner right ventricle and a septum, and we know our conducting pathways. Impulse generates from SA node, it depolarizes both of the atria, it converges in the AV node, and then there is a bundle of his, and then it depolarizes right ventricle with right bundle branch, and it depolarizes left ventricle with the help of left bundle branch, which has two main divisions, left anterior fascicle and left posterior fascicle. So ultimately it depolarizes the left ventricle as well with left bundle branch, and right ventricle with the right bundle branch. And this is what happens. This is a normal condition. So what, and another thing we know that our endocardium, I explained in detail in the previous video, our endocardium is depolarized earlier than our epicardium. So our depolarization starts from inside to outside. When endocardium is depolarized, it becomes positive and rest of the heart was negative. So current was flowing from inside to outside. And then the mid portion will be depolarized. Current is still flowing from positive to negative. And ultimately whole of the ventricle will be depolarized and then no current will be flowing. And when repolarization starts, and we know that there is a special property of our cardiomyocyte that the cells which are first to depolarize will be last to repolarize, and the one who are last to depolarize will be first to repolarize. And we remember our two different types of action potentials. So our epicardium and our endocardium. Our endocardium was depolarizing first but repolarizing later on, and similarly epicardium was depolarizing later but it was repolarizing earlier. So this is what happened during repolarization as well. What happens? This will repolarized earlier, it will again become negative, this portion, and this was and our endocardium was still depolarized, mean it is still positive because it will be repolarized later on, and still current will be flowing from inside to outside. So what does I mean from whole of this discussion? That whether it is depolarization or it is repolarization, our current is flowing from inside to outside, and this is the main reason that our QRS complex and T wave both are positive. So and we know this fact as well. Let us make a new heart over here. We have our heart. This is SA node. Impulse came to AV node and it depolarizes both of the ventricle. When atria was depolarized, what was the direction of our current? It was like this. Okay. When septum is depolarized from left to right side. So left part of septum is depolarized earlier. This is also effect. And right part of septum is depolarized later. So septum will be depolarized like this. And then as I told you, both ventricles will be repolarized at the same time, and the direction of depolarization will be from inside to outside. So ultimately these are the vectors, or these are the current flows which we will be having while depolarization or repolarization, but I will be discussing only depolarization. So as I told you about the method to add vector, so let's add all of these vectors and let's see what happens. So this is the different mode of, actually this is different mode of currents flowing inside our heart from positive to negative at different places. So when we add all of these currents, the final vector which we will be getting will be our cardiac axis, and that cardiac axis will be showing the overall cumulative effect of all the currents flowing in our heart, and that single axis will be representing all of them. So that will be basically the addition of A plus B plus C, D, E, F, everything. So let's add all of these together. I will take all of these vectors one by one. So this was our first vector. I will add second, put the tail of second one on the head of the previous one, and I will do this for all of them. Okay, let's bear with me. just putting these here. I can't do here, so I can add this here as well, because it doesn't make any difference. Sorry, no, not here, here and here. So this was the cumulative effect. So we added all the vectors. It doesn't make any difference which vector we have placed where, but because 1 plus 2 is equal to 3 and 2 plus 1 is also equal to 3. So similarly, A plus B will be equal to C, and B plus A will also be equal to C. So it doesn't matter which vector I put where. What does matter is our answer. So our answer will be a vector which will be starting from the tail of first vector to the head of the last one. So let's make a final vector. So this will be a final vector which we got after adding all the vectors in our heart. And let's put this final vector over here, and I will make this one bigger. So this was the direction of our final vector. So, and this is the direction of our normal cardiac axis. It would be downward, it would be leftward, and it would be slightly anteriorly. So this is how our normal cardiac axis is generated. It is actually the cumulative effect, the addition of all the vectors which we are having in our heart. Okay, so this is one concept, our normal cardiac axis, how it is generated and how it works. So now in this video, in this photo, we will discuss how this axis is deviated. So this was our normal cardiac axis, and from the previous video we know that we have different leads around the heart, and these leads are not leads, actually they are the windows from where we can see our heart. So this was AVR, this was AVL, this was AV, not AV, this was AVF, this is lead 1, this is lead 2, and this is lead 3. So if we see, if we divide this page in 4 quadrants, so our normal cardiac axis lies in this quadrant. Okay, so as you know that these are the window. Let's take an example. I'm sitting over here in lead 2 and I'm looking at the heart, and what will I see? I will see the cumulative current of the heart flowing toward me, toward this lead. So if the axis or the current is flowing towards the lead, what will happen? There will be a positive deflection. On the other hand, if I am sitting over here and I am looking at the heart, so how I will see the current will be flowing away from me, and whenever the current will be flowing away from the lead, it will be showing a negative deflection. So this is the reason that we find a negative QRS complex, negative QRS complex in AVR, and that is always in normal condition. We never find a positive QRS complex in AVR as soon as the ECG is normal. And that is also the reason that if there is no axis deviation in lead 2, we always find a positive QRS complex, because lead 2 is directly looking at the cardiac axis and cardiac axis is directly looking towards lead 2. So let's determine the axis. So we know that when there is no axis deviation and axis of the heart is here, then which leads will be showing a positive deflection? So lead 2 will be showing a positive deflection, right? Lead 1, because it is also in the same direction, it will be showing a positive direction, and lead AVF will also be showing a positive deflection. So these 3 leads will be showing a positive deflection when there is no axis deviation. So let's take an example. that instead of axis being here, axis came over here in any condition. In any condition, axis is deviated towards this side, means there is right axis deviation. Axis is deviated towards right side in any condition. So what will happen? Now, if we look at the axis from lead 1, the current will be going away from lead 1. So in case of right axis deviation, if we see from lead 1, it will be a negative deflection because current is flowing away from lead 1. Similarly, if I am seeing this from AVL, there will be again a negative deflection. On the other hand, if I am seeing from AVF or lead 3, there will be a positive deflection because axis is looking towards AVF and lead 3. So in case of lead 3, there will be a positive deflection, and in case of AVF, there will be a positive deflection. So this is the criteria to diagnose right axis deviation. Whenever there is negative deflection in V1 and positive deflection in V3, or negative deflection in AVL and positive deflection in AVF, there is right axis deviation, and end of story. So what happened in left axis deviation? Let's go back to this photo again. So in case axis goes here, mean it goes to the left. So what will happen? Lead AVL and lead 1 will be showing a positive deflection. So it will be the opposite. So lead 1, there will be positive deflection. AVL, there will be a positive deflection, and it is going away from lead 3 and AVF. So AVF, there will be a negative deflection, and lead 3, there will be a negative deflection. So this is the criteria to diagnose left axis deviation. If there is positive deflection in lead 1 and negative deflection in lead 3, or positive deflection in AVL and negative deflection in AVF, then we will say that axis is deviated towards left. While when there will be a normal axis, there will be, in normal case, I didn't mention that. So normally lead 1 and lead AVF both will be positive. End of story. 3 will also be positive, and AVL can be biphasic. In normal axis, actually what happened, because lead 3 is almost at the right angle, so it can be, mostly it is positive, but it can be a little bit negative as well, but mostly it will be positive in normal axis deviation. Similarly, AVF, mostly it is positive, but it can be a little bit negative. So this is how we determine right and left axis deviation. Now in the last, let me show you one, you can say a shortcut to determine the axis. So when we see ECG plot, ECG paper, so this is the normal layout of any ECG paper. We have lead 1 over here, 2 over here, 3 over here. Here is AVR, AVL, AVF, and there are V1, 2, 3, 4, 5, 6. So it is easier because of this layout. 1 and 3 are lying in a same column, and AVL and AVF are lying in the same column. So it is easier to compare lead 1 with lead 3 or lead AVL with lead AVF. So in this scenario, when we have a glance on the ECG, if we see 1 and 3 or AVL and AVF, they are positive, then there is no axis deviation. On the other hand, if we see 1 positive and 3 negative, or AVL positive, AVF negative, because there is like a mnemonic, like a formula, that because they are leaving each other, so this is why, that's why this is left axis deviation. They are leaving each other, they left each other, one is going to one direction and other one is going to the other direction. And in right axis deviation, what will happen? Lead 1 will be negative and 3 will be positive. Similarly, lead AVL will be negative and lead AVF will be positive. So this will be right axis deviation because they are looking right toward each other. So this is right axis deviation. So this will be easier. Why I did so? This will be easier to determine axis deviation in just having a look on the ECG paper. But I told you this story, this whole story, how it happened, just because so that you should know that what is actually happening. Why in left axis deviation AVL and V1 are becoming positive while AVF and lead 3 are becoming negative. What is the reason behind this? So now you should know that what is the reason behind it. So let me show you the first time during our videos to some of the ECGs. So you will have a look on these ECGs just to know that we have learned normally. So this is our ECG. As I told you, this is normal layout. Lead 1 and lead 3 are lying in the same column. Similarly, lead AVL and AVF are lying in the same column. So you can see that 1 and 3 both are positive and AVL and AVF both are positive. So there is no axis deviation. That simple is that. So in the other ECG, in this one, what is happening? 1 is positive, 3 is negative. Similarly, AVL is positive, AVF is negative. So they are leaving each other. So that is why there is left axis deviation. Simple. And in the third ECG, 1 is negative, 3 is positive. Similarly, AVL is negative, AVF is positive. So they are going right toward each other. So that is why this is right axis deviation. This is the simplest way by which I can explain the axis deviation and how this axis is generated. So that is end of this video. Thank you very much.